Hi, this is Dr. K with Uzima Health and Wellness. I'm also Dr. Kendra Outler, MD. I have created the Uzima Health and Wellness to bring about advocacy that affects our communities of color, and that's specifically our Black community. And tonight we have a special programming that I've worked really hard to create and elevate. So I thank you for everyone's patience. But this is about breast cancer, and we are all fierce breast cancer advocates. And I've got together my best friends to come together to talk about what's passionate this month. And for some of us, every day is Breast Cancer Awareness Day. I have with us the illustrious Dr. Kelly Bolden, plastic surgeon, innovator, and educator. I think she's representing her Spelman best shirt. And again, she's a physician. She is a mom. She is a plastic surgeon to everybody in the DC area and beyond. She's also a Howard surgeon, a professor, and the list goes on. So we have Kelly Bolden. We also have Tamika L. Carter, TLC 2 Fit, TLC Training and Fitness, personal trainer and fitness extraordinaire. So she has a great message for us this evening. And we also have coming back to us Lamar Fun. Lamar Fun is a fierce breast cancer advocate. She is the fighting breast cancer advocate. And I am so delighted tonight to bring this program. I thank you for your patience. And we just have a great show planned for you tonight. And why are we here? We're here because women still continue to die. Black women continue to still die at higher rates. And we want to have action steps. We want you to, if you ever get that diagnosis, to be able to fight and fight with knowledge, fight with information. And that's what we're about. It's not just a simple message of get your mammogram tonight. I really want you to have the information armed to live and thrive, like our Lamar Fund. I want you to find the best doctors possible. And also part of healing is being well and fit. And that's why we have Tamika Carter here. And we also have a special story with her. So as we move forward, we want to present the Lamar Fun story. And there she is. There's Lamar Fun. And so, hi. And so right now, hi, Lamar. And like you said, at the Fighting Breast Cancer Advocate. So we're going to go to the Lamar Fun clip this and tell us who Lamar Fun is. I'm Dr. Kendra Outler, founder of Uzima Health and Wellness. What you do today?
Good to see you. I dropped the kid off at school, and I got my mammogram today.
Girl, but guess what? You're about to learn some more information about breast cancer awareness.
You.
Oh my goodness. And tonight, I'm up close and personal with Lamar Fun as we learn more about triple negative breast cancer.
Thank you so much for all the information.
Thank you so much for inviting me. I really appreciate it. I learned a lot about breast cancer and I'm going to pass it on to my girl.
I am Lamar Fun and I have triple negative breast cancer.
Lamar.
Wow.
that was you. That is actually how we met. Is that too much to take in?
It was. I wasn't expecting. I'm crying.
It makes me feel that way too. That is how
really
we met.
deep. Yeah. That was
So
not
tell
so
us,
long ago.
how long ago was that, Lamar, that you were diagnosed with triple negative breast cancer? At age 50?
Yeah, 51.
Mm-hmm.
And that was 2 years ago.
Mm-hmm.
2 years ago, May.
Mm-hmm. And how were you feeling at that time we met? But you wanted to tell your story. You wanted to be an advocate right off after you got that serious diagnosis. Um, what is it that from there to now that you can say was was is your message to women who are getting a diagnosis of breast cancer and triple negative, the very, very serious cancer?
Yes. My message right now would be to just look it head on and say, I am going to do this. Um, that your future is bright, and to use this as a time to just be introspective, focus on your being healed, and not looking at it as somewhat of a, I'll say it like this, to look at it as a new beginning.
Mhm. When I met you, you were dealing with your symptoms of, you noticed the nausea, vomiting.
I
Your
was very sick, very.
hands were swollen. And what is your full-time job?
Right now, oh well, I have two roles. I am a museum studies teacher at an art school,
Mhm.
and I am also a director of development. So
Mhm.
I do special events, fundraising,
Mhm. Mhm.
as well as I am in the classroom.
And you're an advocate. Tell us about your advocacy work so that we know how to follow you. And also, what are the steps to actually, because I've actually seen pictures of you trying to work with some of our politicians. What is the message from for our civic duty to help with breast cancer?
Well, it is our civic duty to help people to understand that it is a very serious disease, in that it deserves medical attention, um, empathy, uh, helping to make sure that there is legislation, working with those politicians as I work with um, Congress to ensure that they are in support of health care for breast cancer, those who are in the throes of needing medical attention, and or the support for women to be able to get um, their mammograms,
Mhm.
and the importance of their state, county representatives and their state, to be able to support them in getting all of the medical care that they need, on down through transportation, food. There's clothing and accessories,
Mm.
anything that can be allotted to assist women in getting what they need while they're going, should they be diagnosed and need to go through the process, and or even needing to go through the steps of the mammogram, to getting a biopsy, whereby it can distinguish whether or not, or diagnose whether or not the tumor, if you will, is benign or malignant.
Okay, so there's a lot of testing and also surgeries involved and procedures
Correct.
involved. And so you're trying to make sure that women understand they have a voice and that they can reach out to continue to make sure there's funding available for women who are less fortunate to, or even if you just have a job, you have to take off for this so that you can do the fight, right? You got to do the fight.
Absolutely. I
Okay.
mean, people need
So,
assistance, whether you have it's the financial wherewithal to endure the process, and or the support from breast cancer groups, and women who have been through, or the concern, and or those who are the support, how to support a family member who needs to see
Right.
about their um, diagnosis, even if it's benign. There's a lot that goes through a person's head where people may feel something, but they are so scared that they don't want to go through with finding out whether or not it is a more serious situation.
Mhm. So, since you brought this up, there are procedures that our breast cancer friends and loved ones have to go through. And I want to turn to Dr. Kelly Bowden. She's a renowned plastic surgeon. She definitely takes care of patients that have breast cancer. And I want to bring her to elaborate more on these procedures. And let's talk about breast cancer surgery, from the biopsy to even the reconstruction. So, Kelly, do you mind, Dr. Bolden?
Sure.
Please come up and let's talk about plastic surgery for our breast cancer thrivers. I hate to say survivors,
Absolutely.
thrivers.
Yeah, to say thrivers. Absolutely. I'm happy to be here. Thank you so much, Dr. K, for inviting me to participate, and to all the other people on the call. And I'm going to go into the surgical piece, but I just want to emphasize, these are all statistics that we've heard before, but just making sure that, the Black community, there's health inequity across the board, but breast cancer is no stranger to that as well. Black women still have, die at 40% higher of a rate than white women from breast cancer. Our 5-year survival rate is significantly lower than white women for breast cancer. And Black women typically are more likely to be diagnosed at a younger age with more aggressive tumors and at later stages. So when we start to talk about the framework of managing breast cancer, sometimes, people, and I think, Lamar, you touched on it so well about even with sometimes just finding a lump, or even if it's something that's benign, you've got to go get checked out. You've got to get your mammograms annually. You've got to really take care of yourself, because that fear that sort of is kind of endemic in our community, for good reason, the history of medicine in our community is not the best. So there is a lot of fear, but what we want to do is, if you get diagnosed with breast cancer, you want to catch it as early as possible. The later the diagnosis, the more severe the diagnosis, then that's where you start getting into the bigger procedures that are more, have a little bit more of what we call comorbidity, or a little bit more risk associated with it. But the typical patient, if we're doing what we should be doing, we should be getting screening mammograms annually. If there's something that's identified on your screening mammogram, or if they have difficulty seeing what they want to see on your screening mammogram, they may add an ultrasound to that as well. A lot of Black women will get ultrasound and mammogram together. If you're not sure, or they have some findings that aren't quite, normal, you want to push for that. Tell them, say, you know what, I don't want just a mammogram. I want you to do an ultrasound and mammogram, or I need to do more tests so that I can make sure that I'm getting a good look at my breast. Some women even will have to get something like an MRI, but you can get the appropriate screening. If something is identified during the screening process, then they start to get into more of what we call the diagnostic phase. With the diagnostic phase, that typically starts with a biopsy. It's done by the radiologist typically, where they actually can go in with the ultrasound or with whatever modality they're going to use, and they take a biopsy of the tissue, and that's what's going to give you your initial diagnosis. Now, when we start talking about breast cancer diagnoses, though, the things that really will matter are the tumor size, what the tumor biology is. So Lamar talked about triple negative. That basically just means that tumor is not receptive to estrogen, it's not receptive to progesterone, and it's not receptive to something we call HER2, which is another marker. The importance of those markers is that lets you, if it's a receptive marker, then that means that you can treat it with that. So if it's estrogen and progesterone positive, then you're more likely to benefit from hormone therapy to shrink the tumor. So if that makes sense to everybody. So that's a really big deal, because the more positivity you have of the tumor, the more treatment modalities you have. So the biopsy will let us have that information. But the size of the tumor biology, whether that tumor has already spread to your lymph nodes, those are all of the things that go into what we call the staging of the breast cancer. And once you have a breast cancer stage, then we can really start talking about what are the treatment modalities. Very, very rarely, some people can do what we call neoadjuvant chemotherapy, which means that they shrink the tumor completely. But it's uncommon for you to have that and still not have to have a surgical procedure. So whether you have chemotherapy beforehand or you just go straight to surgery, your options when you start talking about breast cancer are whether you're going to do breast conservation, if that's an option. And that again depends on the tumor biology, the tumor, large tumor in an A cup breast, it's unlikely that you're going to be able to do breast conservation, which would mean a lumpectomy or a partial mastectomy are some of the words that people will use. And that means that they take out the tumor with a portion of the breast tissue around it. And then that's what your treatment is for that. But if you have a small breast and a large tumor, or just a really large tumor and a large breast, and it's going to give you a significant asymmetry or deformity, those are things that you want to, kind of keep in mind. So your options are to take out the tumor with a lumpectomy, or some people opt to do a mastectomy. If you do a lumpectomy or what we call breast conservation, then you're going to also need to do radiation after that procedure to minimize your risk of having cancer recurrence in that breast. If you do a mastectomy, a lot of times you don't have to do the radiation with the surgery, depending on your tumor biology, but most times you don't have to necessarily do radiation with that. So those are discussions that we're probably getting into the weeds a little bit, but those are discussions that you have to have with your surgeon. The other piece of it is I'm a plastic surgeon, so I don't actually do the primary cancer surgery. I do the reconstruction after the fact. But if you are diagnosed with breast cancer and you go to see the breast oncologist or the breast surgical oncologist who does the cancer surgery, you want to make sure that they are introducing you to the entire breast cancer team, because it's really, really a team. You need the breast surgeon who removes the cancer. You want to make sure that they have let you see a plastic surgeon who can talk to you about reconstructing your breast. That's whether you're removing a lump only, you still want to have symmetry afterwards. Plastic surgeons can help with that. Or if you remove the breast altogether, we can help to reconstruct the breast. But you also want to meet your medical oncologist. That's the person that would be responsible for providing chemotherapy. Your radiation oncologist, if you end up needing radiation in addition to your surgical procedures. So there's really a large, what we call a transdisciplinary team that needs to be involved. And a lot of times underrepresented minorities and Black women in particular don't get offered the opportunity to see all of these different providers. And that is so critical to making sure that you get the adequate care that you need. So I would say the biggest message to go from here is you have to be your own advocate. Push, push, push. If they tell you they don't have a plastic surgeon for you to meet with, then you say, I need to find another doctor, because you should be able to see all of us, because our goal is to make you feel as whole as possible going through this process. And I don't want to take up too much time, but if we get into details about reconstruction and all the things that there are to offer. But I love what Lamar said earlier about this is a new beginning, because it really can be. I tell people that, the breast cancer piece sucks, but guess what? Out of that, we can give you a whole new set of breasts if you like. We can give you a perky breast. We can give you a larger breast. We can make your breast smaller. So all of those options are on the table. So if there's a little bit of a silver lining, I like to at least tell patients that's something that I can offer.
I think thank you for that very detailed. So I didn't want to interrupt as a host, but let me bring up two things that I think that we need to put out there. There are breast centers, right? There are breast care centers. And as breast cancer and breast cancer treatment has evolved, we need to be able to access these centers. So the question becomes, as a doctor, I'm an anesthesiologist. Of course, we interact. You may get a consult with me or not, but I'm also part of the breast cancer care for the patient's team. But the Dr. Bolden, my question is, how does a woman find out the best centers? So let's say you're in a part of DC where, you're at a center, and then the center, they send you to, the GW, or I don't want to name institutions, or they send you to different places. So what I'm finding out is that seeing from patients that they have to put together their pieces. I don't see you here, but I'll see you here. Are there regional breast cancer centers? And I think that goes back to the advocacy that Lamar is talking about. We really need to be able to have streamlined care, particularly for Black women, from the place of diagnosis, even if it's an outpatient center in their community. And they should be able to seamlessly go to a major breast center where you actually will have a um, a plastic surgeon, a surgical oncologist, and a medical oncologist, and radiation therapy. And even if because and it's not our fault that these places can be in different centers, but I think what could happen is that there should always be a process whereby you almost have a ticket and it's signed or some type of computer notation, because part of the frustration is that people say, "Well, they told me I have an appointment in 3 more months." And have you found that, Dr. Bolden, to be what we call a fixable problem? Because I really wanna make sure people have something that they can say, "We can work on this."
Yeah. So, I mean, I think what you're referring to is probably, at least in my eyes, the biggest and the most challenging part of breast cancer care, or probably any cancer care that has a continuum of treatment.
Mhm.
Unfortunately, underinsured patients struggle the most.
Mhm.
And you mentioned institutions, and I won't go into specific institutions in general, but this happens all the time. So say someone in the DC area wants to go to a certain hospital because they do have the breast center or what have you, and they have great breast surgeons. The way that the insurance works, most people can get the operation done,
Mhm.
but maybe their chemotherapy is not covered. So
Mhm.
then now they've gone to an institution where they've had surgery, but now they don't offer the chemotherapy. And so now the patient is having to totally kind of regroup and find out where can they go and where can they get their chemotherapy covered.
Mm.
And the only real solution to that is to really work on the advocacy piece, because it can happen. It's just the same thing. A lot of women don't know that breast cancer is covered. It is a covered benefit from the time that you have your breast cancer
Mhm.
removed through the entire reconstruction
Oh.
process. And a
Oh.
lot of women don't know that. That is legislation. That is a covered benefit for all
Oh.
taxes. And it's something that people don't know.
I think you're right about that. I think because one of the challenges right now, and I'd like a poll on this, is if women are having trouble getting a mammogram, really in 2023, as we're like 2.5 years past, 3 years now past COVID. I'm actually hearing some women say, I can't get a mammogram. This place is full. And I actually had to say, any place will take you. So call around the city and find a place to get your mammogram. I personally like to get my mammogram at the same place.
Yeah.
So I get it, but at this point, I'd rather you find another facility than to miss a year, particularly if you're over 50. The question I have for you, Dr. Bolden, is does it matter if you change places? Because I think that is a big hesitancy for some of our women out there right now that are having to make that decision.
So it's always easier if you're getting your care in the same place, just because of the fact that everything is accessible to all providers. Now that's another area of advocacy that would be great, was there should be some universal way that medical records should be accessible, to any provider at any state or any time. But the reality is that if you go to most institutions, if you go to hospital A and that's where all of your mammograms are done, but then you happen to go to hospital B, it's not that the two can't
Talk.
exchange, but you have to sort of be that facilitator to make sure that those images get either hand carried, which hopefully you wouldn't have to hand carry, but that those images get sent to the other institution. Because one of the things that's really important in not only mammograms, but a lot of things in medicine, is you always want comparisons. Even things like EKGs.
Yeah,
You
year
know,
to year. But for the breast, I mean, you have to my breast at 20 are not the same as 30, not the same as
exactly,
40, not the same as 50. And so
exactly.
that's something that, helps. But I think with digital medicine now, we can send
Yes,
these visions, because I remember the time when you had to take your disc to your new hospital with your new imaging.
yeah.
So we're not doing that. I
Well,
really what?
even now, everything is digital, but if they aren't on the same system, so
Yeah.
it's really kind of
Ah.
frustrating in that respect. If you get your breast done on a Siemens imaging machine that works with X medical electronic medical records, it may not be quite that simple. It can be done, but you may still have to facilitate getting those images transferred to somewhere else. But
Mm.
not a huge deal. And to go to Dr. K's point, don't hesitate if you have to go somewhere else, do it, and just know that you're going to have to either take that image to your old hospital or vice versa, so that they have some sort of comparison. It doesn't mean that they can't get a good read on it. They'll read it. It's just sometimes they need to compare if we've had some sort of finding on a prior mammogram.
So right now, I want to remind people that we're here having our discussion on breast cancer advocacy and breast cancer awareness. We have three outstanding guests. We have Dr. Kelly Bowden, a plastic surgeon who represents, who's been a professor of surgery at Howard University. She also has her own private practice in the DC area. We have outstanding Ms. Tamika L. Carter, also a Howard graduate. I'm sorry, I have to say that. And she is of TLC 2Fit, and her company is TLC Fitness and Training and Fitness. And we also have our thriver, Lamar Fun, and she gave us her breast cancer story at the beginning of the show. And we're just happy to be here to really try to address some of the concerns that are top of the list for Black women who are struggling with the diagnosis of breast cancer, or you're supporting a friend. Because I know I've had to support some friends, and I've said, okay, I'm coming up there with the magazines while you get your chemotherapy, or you know what I'm about to do? I'm about to put on a sweatshirt, and we're going to lie here in this bed and watch TV while you rest, post chemo, post surgery. So even if you don't have the diagnosis, somebody that you know, somebody that you have befriended, and your family, or just might need your support right now. So this is sweatshirts and hoodies. Get comfortable learning about breast cancer, get comfortable, just taking in this information so that if you have to do the fight, I want you to be prepared. I want you to know that you can conquer it. Thank you, Lamar, for your testimony. She is a testimony.
Mhm.
And I have one question. We had a poll that was going to talk about whether you are having an issue getting your mammogram after COVID. And I'll say just for this year, 2023, we should be doing better. Even if you have to go to, let me know if your mobile mammogram that you used to go to is not back. You can put that in the comment section on our Facebook. Um, and also, let me know if you think that we need to lower the age to get a mammogram. We now say 40 and over, but there's some push, and this would be back to some of the advocacy that Lamar brought up, that we need to maybe think about lowering the age for Black women. If we have this higher rate of breast cancer, and I said, in terms of the numbers, and it doesn't, statistics mean something when it happens to you or someone you love. So then you're like, well, why did we get the mammogram at this age when maybe we could have caught it sooner? So if we know that Black women experience breast cancer at earlier ages, and that it's more aggressive, that's something that maybe insurances will start to cover, or maybe we advocate for getting screenings early for Black women. And so Tamika L. Carter, part of after having surgery, after getting diagnosed with breast cancer, whether you have surgery or not, one of the key points is wellness. Is really trying to make sure you recover, that you are spiritually ready for the fight. And if you've ever looked at a sister who said, I just got diagnosed today, I am that one today, there's a fight in that face. There's a fight that says, nope, not going down right now. So, Tamika, I want you to come and tell us about why you're an advocate for breast cancer.
Okay. Thank you for having me. Thank you to the guest that spoke before me, Dr. Bowden, my good childhood friend, Lamar Fun.
I'll let you say it. Let you say it.
Yes. So I'll do a side note before I get into the story. So Lamar let me know when she got diagnosed with breast cancer. And at that point, if you look at Dr. K's old footage, yes, I had hair long enough to roll on a grain of rice. So I'm growing my hair out to donate it in honor of the thriver, Lamar Fun.
Oh.
Yeah. So I was like Dr. Bolden 2 years ago, and I was like, no, I'm growing my hair out. So I'm growing it out, and hopefully next year I'll be able to cut it off, and maybe we can do it on here.
So what do you do with your hair?
I donate it to breast cancer survivors to make wigs and weaves and whatever else. Oh. I need 12 inches, so we're gonna blow this out sometime soon. I was at 6 inches. But
And
yeah.
who do you donate it to? Please tell us. Please.
Locks of love. Locks
Okay.
of love is lots of love. Is that correct?
Lots of love.
Thank you. Lots of love.
Oh.
No color. It can be no perms. No creamy crack. You have like a Brazilian blowout type treatment to it, but nothing other than that.
Oh, wow.
But yes.
That is outstanding. Okay.
Yes. So we'll see how long the stuff gets, Pumpkin. Plenty of time. I to comb through it after I wash it. I'm like, Lord Jesus.
And they're going to take your hair.
Yeah.
And they're going to make a product for hair loss for women of color, for Black women. So we need more textured wigs.
Right. So I was talking to a lady today, a client today, and I have to see how they do it, because when they get it cut, it's going to be blown straight so they can cut the full length. If they can wet it down and get like a fro, then hopefully our sisters can benefit from that. They want to have like a natural look to their hair. I don't know what they're going to do, but yeah, that option will be an option with my hair. I don't know if they're going to treat it or what they're going to do, but they'll have 12 inches of TLC.
All right. I love it. I love it.
Go for it. So
that's something else. Are wigs paid for? Are wigs? And because this is a big deal, they may say, sometimes we think about, hair pieces, and we know wigs are very common now for every day. But if you're, I remember when Lamar had her, that's how I met Lamar, with her wig. And when we did the shoot and put on makeup, she says, "Oh my gosh, to see my face with eyebrows and I have a wig on," and it really meant something. So that is probably one of the most distressing things for women, to start to see that process happen, the loss of hair. I think it's just more symbolic of the change that they're going through, not that they're even remotely trying to be superficial. I remember two of my friends saying, I don't want to wear a wig, but they had to get to that point, you know what I mean? And then the hair grew back. So I think that, that cancer look, still terrifies people. So this is awesome advocacy. So Tamika, also tell us, what more are you doing in this fight?
So I got into the fight by way of my mother. My mother, unfortunately, passed in 1988 when I was 18 from complications from breast cancer. She was diagnosed in 86. We lived in this area. Actually misdiagnosed. So as Dr. Bolden spoke of, we were on state assistance, and we go to the health clinic, and they sent her to no longer around DC General Hospital. DC General Hospital lost her results, and they made no effort, nor did the doctor from the clinic make any effort to find the results. 2 years later, something happens. I'm 50 something years old, and I'm in menopause, so my memory's gonna go in and out.
Well, I recorded you a couple of years ago, and it was just, you're doing a powerful job then and now.
So they didn't find the results. They finally sent her back for another round of tests, and that's when they figured out she had breast cancer. And at that time, they were doing partial mastectomies, and so she got a partial mastectomy, and that was in like 86. I was 16. And by the time I was away in college in 1988, she passed. She went into remission. It was, no longer there. She was no longer positive with breast cancer. But then 2 years later, it came back and it spread to her liver. And it's kind of ironic that breast cancer month is October. I came home October 31st of 1988 from Towson State University. My boyfriend at the time, his mom called me and said, "You need to come home." She had been in the hospital a whole month, but she was like, "Do what you need to do, go to school, get your education, blah, blah." So I came home on the 31st, which was a Monday. She died on around 2:30 on Wednesday, November 2nd. I remember this because the stories were on in her room. One Life to Live was on. That's 2:00. And I walked out the room. My father came, they brought food, and I heard Code Blue. Go into her room. And it's still,
Tamika, even when you tell me the story, I think that those of us who have to experience the children, this is what I think is not my focus too, is that there are children of women who die young, who miss their mommies forever. I love your pictures of you and your mom. I've put them up on my website before. There to have an ailing parent, to have this tour de force in your life, uh, actually trying to protect you. You really didn't know the depths of how much she was going through. And you're not the only, child of someone that was passing from breast cancer that he just didn't know, because these moms do not want you to know.
No.
And I think that, changing the narrative of breast cancer disease to one of a family, that how it affects the family is something that is also undertold. Sometimes we just have this picture, like some of the promos, I just see one woman standing there, but this woman is connected, like, to children. And today in the gym, I said something, oh, I'm doing a breast cancer presentation, breast cancer awareness. And the girl pulled down her shirt and she had a tattoo of the pink ribbon on her. And she said, this is in honor of my cousin who I considered my twin. So if she's 32 and she passed, I was like, it just kind of stopped me because, for her to open that up and say, yeah, I keep my tattoo on my, it was on her heart. I was like, wow. So it's deep and it cuts deep. And I think that I'd like to have, what is it that you think your mom, why does she shield it from you the most? Why do you think?
She was always protecting me. I'm only child. It was just she and I. Definitely she was like, no. And basically we, getting a little bit more spiritual. I was like, well, her protecting me was a good thing for her and she needed to do that. But it also just kind of like, okay, if she's not worried about it, I'm not gonna be worried about it too much. And God's gonna protect me. He's not gonna take my mom away from me because that's all I have. So when that happened, I was like, Lord, we need to talk.
Yeah. You said you and God had it out for a while.
Oh yeah. But
and husbands and sons and sisters and friends, we are, we're always looking over our shoulder like, really, is this how this played out?
right.
I have a question, because you mentioned that you all were on assistance, but you told me something very powerful. Your mother was a very astute and wonderful person in the community. So I want to go back to that because I want you to describe who your mother was.
So how Steve Harvey said she was a cussing crew. Very lively. Her nickname at church, she was part of the courtesy club, and the courtesy club would welcome folks or new members to the church or visitors to the church. And her nickname for the courtesy club was President Snap because she was so quick to, get you straight in case you got wrong. You wouldn't let her pull you back to the right. She's quite a character. Lamar can tell you it's very much because we spent a lot of time in each other's houses. Each other knew each other very well, and it was quite funny.
Tell me her name. Tell her name. What's her name?
My mother's name was Barbara L. Carter. And she gave me my initials. So that's why I always use my middle initial, my name. Someone tried to post it without. I was like, oh, punk, in my bio had the middle initial in there. I need to put, that in there for me. Yeah.
That's right. I had to get that right. And Lamar, do you remember Tamika's mother? Hold on. Get off mute. Tech guy, get off mute, guy. Hold on. Hold on. Get off mute.
There she is.
Yeah, okay. Yes, please. Because we're gonna wrap up.
Barbara, what? There is not a day that does not go by that I do not think about Aunt Barbara. She was a fun force, very authentic.
Authentic.
You were not getting the representative. You were getting her.
I love it.
And just totally unforgettable.
So we all, even growing up, those memories of your mom, Tamika, and then I'm sure the strength that she had also said, okay, to Lamar, hey, we're gonna do this. We're going to beat this. So Tamika, something else I called you for because like I said, women are faced with a lot of challenges with cancer. Cancer in itself can attack the cells and the muscles. And so have you ever had to train anyone with cancer? And can you talk about what you think women who have cancer in particular need and can do while they're going through care?
Yes. Yes. So I actually added the links. A link. I was when I worked at Equinox, I think it's 2015. Bethesda Magazine did a story on myself and my client and how our stories overlapped and how we came to be a client and a trainer partnership. So that link is on my bio for my Instagram, which is TLC, the number 2, FIT, TLC 2 Fit. You go there, click on the link in my bio, 1 of 3 links. You'll see the article there. It's called Stronger Together. And she came, Lisa Feldman is her name. She came to me and she had just been through reconstruction, I believe, and she wanted to do the Avon Walk. The Avon Walk was happening at that time. It was the 2 days of basically doing a marathon. First day was like, a marathon and a half. First day was like 26 miles. Second day was like 13 or something like that. And first time she did it with her friends, and they actually camped outside. And I was like, when y'all get a 4-star or 5-star hotel with turn down, I'm there. Like, big, don't do tents, Pumpkin. Don't do tents. No, sir. But she said, do you think I can do it? I'm like, yeah, you can do it. I was like, hell yeah, let's do this. So I trained her and she did the walk, had no problems. She was also part of a walking group. It's a very, very important thing to prep. If you're doing a walk or run and you're not used to it, take a page out of my book. So the next year I did it with her. And I'm like, I run here and there and I do a lot of weights and whatever else, but I never walked that length of time, that length of 3 miles. So the first day I was hobbling back to my car. I was like, in Jesus' name. That was a lesson learned. But at least I had the proper shoes and socks. It was a great fun time. So I think we did it 2 years in a row thereafter. But she did a great job. I've had a client from England who was diagnosed after we've been trained together. She's one of the folks that I know has had a successful lumpectomy and is thriving and is doing well.
Okay.
I've always told myself that if I ever come down with it, I'm taking it all off, take everything go.
So, and I'm gonna let Dr. Bolden. I want to ask you a really quick question, and I know I don't want to go over too much, but are you double mastectomies? Okay. Is there any plastic needing procedures after you decide to either have prophylactic breast removal? Is there any additional asymmetry or work that you can do for them?
Oh, absolutely.
So tell us about that, because that is why like I said, we would have to have a 2-hour show to talk about all the things. But again, since women are Black women may have to be faced with this decision, and I've heard that even if it's not indicated, more Black women then will say, take them both off. I don't even want to think about it anymore. So, and as opposed to them, just not having any symmetry or some type of cosmetic, what could you offer them?
So that's a great, we absolutely, the beauty of breast reconstruction is we can really offer anything. And so I always tell patients when we start talking about breast reconstruction, and this is a relative thing. Sometimes when people remove both breasts, the reconstruction is a little more straightforward because now you aren't really trying to match symmetry, right? If you keep one breast and then you're reconstructing the other one to match your native breast, it's a very challenging thing to do. Can we do it? Absolutely. But when we do mastectomies, whether we're doing one side or both sides, when we talk about the types of reconstruction that we can offer what's called implant-based reconstruction. That's typically reserved for people who are looking for shorter recovery or who maybe have a perky breast on the other side to start. And so an implant reconstruction would be reasonable to match the other side. Also keeping in mind, matching procedures for the opposite breast are also covered. Okay, so even if you only have breast cancer on the left side, you only have your procedure on the left side, we can always match the right side to match the left side, if that makes sense. So some people will opt in. They'll say, you know what, I want to do an implant-based reconstruction. My other breast needs to be lifted. So we can do an implant-based reconstruction on one side. We can lift the other breast to match the implant. If you go with a larger implant, we can also lift and augment the other side to match. If you do both mastectomies, then you can do implant-based reconstruction with any, with whatever volume you see fit. If you also can use your own tissue. So some people don't want to use an implant and they want to use their own tissue. So we can actually use tissue from the back. We can use it from the abdomen, which is one that most people see most commonly. Those are called either tram flaps or deep flaps. You can use tissue from your buttock. It just depends on what we're trying to do, what the goal is, also what the preference is of your surgeon. I always tell people there's a whole spectrum of things that can be done from a reconstructive standpoint, but you definitely want to communicate with your surgeon and make sure that you understand what they're best at. Because it's like there's a ton of different ways to do things. You don't want to go in and insist that your surgeon does a certain type of skin flap that they're not accustomed to doing. So, but the beauty of breast reconstruction is we can match your native breast. If you're saying that you're only going to do one side, there are ways that we can match the native breast, but there's also ways that we can match the other breast to match your reconstruction. So the biggest takeaway is implant-based reconstruction using your own tissue, which is what we call autologous tissue reconstruction. Or I always like to stress to women, there's also the option of no reconstruction. So sometimes there's that pressure that you have to get breasts back. You have to do reconstruction. I want to make sure every woman knows that option is available. And that's what I love to do. But there's also things that plastic surgeons can do for women that don't choose to do any reconstruction at all, but may think about doing prosthetics in the future. And so we can rearrange the tissues so that the chest wall has a certain appearance to it, so that you don't have that concavity that's sort of stigmatic of women that had breast cancer and had mastectomies with no reconstruction. So those options are always available. One other, one to make two comments about with that were really that were so critical. I love that, when you talk about the relationship with your mom, one thing that we, and especially as Black women, we're always protecting everybody, right? We protect our kids, our every family member. And we have to start learning, though, to lean, because one of the things about breast cancer in Black women and why some of us are diagnosed at younger ages is there's a genetic propensity.
Yes.
And so there's genetic testing that can kind of let you know, are you at a higher risk of developing breast cancer? So we want to make sure that we're sharing with our children and with our sisters and our aunts and cousins and things like that, even men, because men also carry that same gene. The BRCA or the BRCA gene is most common, but there's actually a host. And they're actually, now that research is being done on more women of color, we're finding even smaller genes that may be there. So that's something to keep in mind. And then going also with Tamika and the fitness piece, as a surgeon, one of the things that's so critical,
and an anesthesiologist,
and oh gosh, it's actually that team of us, right?
Right.
When Dr. K and I are looking at patients, fitness is so critical that to the point where in medicine now there's actually a movement toward what we call prehabilitation, which means getting patients ready for surgery. And so it's better to, I can't remember, I was just watching this movie and the girl was saying, you don't have to get ready if you stay ready. And I feel like that's what you have to do. Just stay ready. And that way you don't have to get ready. Don't smoke. Cigarette and tobacco is the worst thing for any surgical outcome from an anesthesia standpoint.
And wound healing.
All of those things. Don't smoke. Try to eat healthy, stay fit, good cardio. All of those things are so critical just to the total wellness, and just people that have better prehabilitation have better outcomes. And there's plenty of data to support it now.
That is our whole next show. And I think
that's one of my favorite topics.
I can tell. And I just, like I said, I hope that this is a very proactive talk. I hope that this is something that everyone can take home and say, this is what I can either share with my sister friends and sister loved ones, that when someone is leaning on me, whether it's my mom or some other relative, that we understand that there are things that we can do go to doctor's appointments. I think Lamar told me she had brain fog. So having someone write down names and remember appointments. And again, Lamar, thank you so much for your advocacy. She's fighting breast cancer. Did I say that right, Lamar?
It's the Fight Breast Cancer Advocate
There it is. The Fight Breast
or
Cancer Advocate.
or the Breast Cancer Advocate. I have two. That was the
Okay.
chemo brain. I
Okay.
didn't know
Well, you got both of them, and we have Tamika. Let us know how we can find and see your all inspiring videos. And I was like, I'm doing my deadlifts. I'm about to do my deadlifts. Tell us your Instagram and how to.
TLC2Fit Instagram. You can
Okay.
find me on there. See my videos, my reels, my puppies.
That's right.
No, I love
And and Dr. Bolden, how do we find you? How do we find you?
Yes. So my Instagram is the Bolden Beautiful, all one word. And that's probably the best way to find me. As Dr. K mentioned, I do practice at Howard. I'm still an assistant clinical professor there.
Mhm.
So you can find me on the Howard website. And then my private practice is Cultura Plastic Surgery. But I do breast reconstruction. I do aesthetic breast, aesthetic body. So I pretty much kind of cover the whole thing. And that's probably another topic, even just to talk about aesthetic breast in general. So
We can do. And I thank everybody for listening and being patient. We definitely want to give you good quality conversations. I think it's so important for us to have very culturally competent conversations that uplift and inspire, that also empower us with some actions, a to-do list, so that we can take control of our health individually and also safeguard our communities. That requires a lot of advocacy. And I thank our three advocates tonight, and I appreciate it from the bottom of my heart, because I've had to support, like I said, my breast cancer friends. And I think 2 days ago, I saw a message that Georgetown, shout out to the Georgetown community, but also supporting them as this was announced. And I was just looking for something else. And I want to uplift this sister, and I want to uplift her name and her contribution to at least one university that I know about. I'm sure she's been more impactful. And she, as I read, had metastatic breast cancer. So as we started to talk about our why, this is our why. And so we want to send our condolences to the Butts family, but we also want them to know that their daughter's life was impactful, and it's going to spur us on to continue to do this work. Okay. So that is Uzima Health and Wellness, and I thank my guests for giving me their evening. They have families to get to, and I appreciate it. Support Uzima. We would definitely want to do more on the Lamar Fund story. Support Uzima by joining the newsletter and signing up, so I can show that there are people who are listening and want to have this information that can empower them. Thank you and good night.
good night.
You know, I still can't believe it. It's been 15 years since you called me that day and said you had breast cancer. I was in total shock.
I know, it's been 15 years. Think, the boys were only 5, 6, and 7 years old.
Yeah, but you were very strong through that whole process, so it made things a little easier on them.
Look at that beautiful cake
Yes.
you brought me. Oh my goodness, thank you so much.
Hey, anything for you is a beautiful cake. Hey, you want to cut it?
Absolutely. No, not with a fork. Let's go get a knife.
For some of us, every day is breast cancer awareness. Go get yourself checked. Early detection of breast cancer can mean a better treatment, better survival. The CDC recommends that women have their first mammogram at 40 years of age. I had mine at 28 because I felt something and I had a family history. Early detection of breast cancer can mean a better treatment, better survival. Let's find a cure for triple-negative breast cancer.
How's the game?
It was so good.
That's
Those
good.
fans were marching. Just the energy, the spirit,
All right.
and friendship.
Really?
Just felt good energy.
Hey, Jay.
Hey,
Jay.
lady.
How you doing?
Good.
What you do today?
Dropped that boy off at school.
Chooks?
Yes, and then I had to stop and get a mammogram.
You got a mammogram today? You got
Yeah,
your breast
mush.
exam?
Yes.
You got your breast exam.
I got my breast exam and
That's good.
Was it hurtful? Like,
ill.
It's important though. You know, my mom passed away from breast cancer, so it's so important that we get our breast exam.
It is.
Just a little bit of pain, but then it's really worth
so
it.
much.
It's not medical talk, it's sister talk. Something that casual and simple can be life-saving. Go get yourself checked. The CDC recommends that women have their first mammogram at 40 years of age. I had mine at 28 because I felt something and I had a family history. Early detection of breast cancer can mean a better treatment, better survival. Let's find a cure for triple-negative breast cancer. If I was to go to a snazzy affair, I would want the dress to be pink. I enter my home and everything reminds me of her and her fight. From the pink glass to a simple note, there's always a picture to look at, to walk by. I hear her voice going, "Keep going." I pass a pink glass, another picture of a breast cancer fighter. Enter the bathroom. Will I choose a pink hat, or will it be a cute afro wig? I remember asking one of my friends who had cancer, "Do you want to wear a wig?" She said, "No, I don't. I want to live." For some of us, every day is breast cancer awareness. Go get yourself checked. Early detection of breast cancer can mean a better treatment, better survival. Let's find a cure for triple-negative breast cancer.
Good night.